Hi, I'm Dr. Danella Hellenkamp. I am a doctor of audiology in the state of North Carolina. I work at Triangle Hearing Services in Cary, North Carolina. And a frequently asked question that Dr. Gupta and myself receive is, what happens when we come in for a hearing test or a hearing evaluation? When you come into our office for a hearing test, we do a lot more than just the testing itself. We start by going through a thorough case history, not only of your previous medical history, but of your hearing health. We then use a little otoscope or a light to look down into your ear canal to make sure your ear canals are free of wax or cerumen and make sure that the anatomical structure looks normal. And then we proceed with a hearing test where we have you repeat words and press a button or raise your hand when you hear a tone or beeping sound. We also do some testing where you don't have to respond at all to assess the function of your middle ear system and the function of your outer hair cells. We then sit down and go over the results of the test with you. We discuss the results so that you fully understand what the results are, and go over to determine whether or not we feel that hearing amplification is something that's needed for you, whether or not you need a referral to a medical doctor if we feel any medical intervention is needed. If we do feel that hearing devices or hearing instruments are warranted, we go over in detail what we feel is best for you based on what your lifestyle, what your needs are, and from a cost standpoint, what your budget will allow. So we go over in great detail on an individual basis what works best for you specifically. To find out more frequently asked questions that we receive, please visit our website at www.trianglehearing.com.